Hi all my viewers. Today let's talk about incisions in periodontal surgery. There are various types of incisions that we use in this type of surgeries. The number 15 or 15C surgical blade is used most often to make these incisions. And the first one is horizontal and the other is vertical. In horizontal itself, there are different types. First is straight and scalloped, and the other is external bevel and internal bevel, then clavicular, crestal, and submarginal incisions. What is a straight incision? Straight means, as the name indicates, it follows a straight line. Can you see this picture? It follows a straight line. Scalloped means it follows the scalloped morphology of the gingival architecture, and this has to go from the mesial line angle to the distal line angle, and this is important because it maximizes the width of the surgical papillae and also to allow the tight adaptation of the flaps to the roots. And in this case, we need to take into account the root anatomy to optimize the primary closure. And next we will talk about external bevel and internal bevel. Little bit confusing because in the textbook they have shown the diagrammatic representation that is little bit confusing. So I uploaded here some clinical pictures so that you will understand the concept well. The first, external bevel means it has to, the blade, tip of the blade, this has to go apical to coronal. That is external means outside. That means it has to go near the towards the tooth surface. Tooth means outside. Externally we can see the tooth surface, no? So the blade has to go from apical. See, this is the root area. It has to go from apical to coronal. So the blade position has to be like this. It has to go from apical to coronal. Whereas internal bevel, it goes from coronal to apical. Can you see the angulation of this blade? It was there from here and it goes upwards. That means it goes coronal to apical. Okay, so this is the difference between these two. And this external bevel is used in gingivectomy, where the primary objective is the pocket elimination, because the end of this blade is towards the pocket area. So after the incision, this incised tissue eliminated or discarded. So the healing would be via the secondary intention. And external, see, it has to go from the apical area to the coronal area. The base, this ends below the base of the pocket. Whereas internal bevel, it goes coronal to apical. It can be seen, especially we do in flap surgeries, where the primary objective is the pocket reduction rather than the elimination. Here, the pocket epithelium and part of the inflamed connective tissue is eliminated from the non-inflamed counterpart, and then the remaining flap portion is readapted with root surface. So healing would be via the primary intention here. There is no much gap here, so the healing would be via the primary intention. So I think you are clear about the difference between the external and internal bevel. And next is the clavicular, crestal, and submarginal incisions. So clavicular or sulcular, this kind of incision, this starts in the gingival crevice and is directed apically through the junctional epithelium and connective tissue and down to the bone. If you see the end of the blade, then you will understand the better. It starts in the gingival crevice. It mainly, this type of incisions mainly used in the regenerative periodontal surgery to retain all the gingival tissue to maximize the blood supply, and also it used in the flap surgery that required in the anterior maxilla, where the aesthetic is a major concern. And next is the crestal or marginal. It starts at the surface of the gingival margin, directed apically and down through the epithelium and connective tissue. There is no gap. It has to go near the margin of the gingiva. And next is submarginal. Submarginal means it's not very near to the tooth surface. It has to go little bit beyond that. So this depends on three factors. First is transgingival interdental probing depth, mucogingival junction, and depth of the palatal vault. Then this transgingival interdental probing depth is a guide for the placement of the submarginal scalloped incision. Here, if the probing depth is 6 mm, and then this incision has to be placed a distance of half to 2/3 of the transgingival interdental probing depth away from the tooth surface. So if the probing depth is 6 mm, then it has to go half of the this distance. So the 3 mm of distance should be there. So that is that. And then is the mucogingival junction. So this incision, this has to place depending on the mucogingival junction to preserve at least 3 mm or above of the keratinized tissue, or indirectly we can say as the attached gingiva. That means if the width of the attached gingiva is narrow, if this is the tooth, and if this is the marginal gingiva, and if this is the attached gingiva, so if this much of gap should be there at least. But if the width of the attached gingiva is narrow like this, and then the submarginal scalloped incision will be placed closer to the gingival margin. Then it has to be placed closer to the gingival margin. So it's such cases, in spite of the submarginal incision, you can do the marginal incision. And if the width of the keratinized tissue is broad, like this much of distance is there, means then the submarginal scalloped incision will be placed according to this transgingival interdental probing depth. And next is based on the depth of the palatal vault. If you see this two picture, here it is a shallow palate, here it's a deep palate. So in a shallow palate, the more submarginal an incision, the closer it will be to the midline, and the farther away it will be from the tooth surface. It would be little bit closer to the midline. Then the next is in a high palate like this, a submarginal incision remains close to the tooth and allows for the primary closure of the flap. So this is about submarginal incision. The decision has to be made based on these three criteria. And next is vertical incisions or oblique release incision. This can be used on one or both ends of the horizontal incisions depending on the design and purpose of the flap. And this vertical incision is necessary if the flap is to be apically displaced. And this incision that must extend beyond the mucogingival junction to reach the alveolar mucosa, so that it allows the release of the flap to be displaced. So this is the vertical incisions. Can you see? These two are the vertical releasing incision. In general, these vertical incisions in the lingual and the palatal areas are avoided. So this is all about incisions. I hope you all are clear about this. Thank you.